Welcome to Covaris webinar on FFPE sample preparation. This Covaris webinar will focus on FFPE sample extraction using Adaptive Focused Acoustics or AFA. With AFA, we enable detection of gene fusions that were undetectable with other kits and lower quantity not sufficient or QNS rate significantly. In today's agenda, we will briefly mention why FFPE samples are challenging to process, how Covaris AFA technology offers a superior solution for FFPE sample preparation, present KOL data to support Covaris claims for high-quality NGS-grade nucleic acid extraction, and then we will close with sharing a key customer success story from Omniseq on Covaris FFPE workflow automation and high-throughput solutions. We have been using AFA over 20 years, and Covaris is known as gold standard for DNA shearing. However, our adaptive focused acoustic technology goes beyond DNA shearing applications, and today we will focus on the power of AFA in sample prep, specifically with processing FFPE samples. FFPE samples are difficult to process due to poor quality of source material that often contains degraded and fragmented DNA and RNA. Formaldehyde used reacts with proteins and highly cross-links RNA and DNA. There is no standardized workflow between institutions for embedding tissues that results in further variability. In addition, the first step in processing FFPE samples is to remove paraffin. All current traditional methods uses organic solvent-based de-Paraffinization that is laborious, time-consuming, and must be done in protective hoods. The overall workflow is thereby very complex and cannot be automated. Currently, there are 3 workflows for processing FFPE samples. One can start with a single sample and then take it through paraffin removal, tissue rehydration, PK digestion, reverse crosslink, and purify either DNA or RNA. Second, you can start with a single sample, but then split the sample after reverse cross-linking step. From one, you can go ahead and purify the RNA. With the other workflow, we can go ahead and purify the DNA. In this workflow, you do sacrifice the amount of RNA and DNA that you get from one sample. And third, the more popular method is the selective purification method, where you start with one sample and then perform sequential extraction of RNA and DNA. After the centrifugation step, the RNA is recovered from the supernatant, the DNA pellet goes through a PK digest, reverse crosslink, and then the DNA is purified. In all these approaches, one step is common, and that is the paraffin removal and tissue rehydration step. Currently, this critical step utilizes organic solvent-based de-Paraffinization. Paraffin removal with organic solvents has major drawbacks as highlighted here. Bottom line, it is laborious, requires working in fume hoods, increases carryover contamination risk, and if your site is using such method, you will require a specialized waste disposal system in place. However, with Covaris innovation for FFPE extraction, there is a better and efficient way to remove paraffin with AFA technology. Let's talk a little bit about the origin of AFA technology. Adaptive Focused Acoustic is based on highly developed technologies applied in demanding medical field. For example, high-intensity focused ultrasound applies non-contact acoustic properties to break down kidney and gallbladder stones. Diagnostic ultrasound uses an allied low-intensity focused ultrasound for patient imaging. Covaris AFA is the combination of both technologies optimized for biomolecule processing. The same exigence of medical-grade technology that is precise, reliable, and controlled is applied to DNA shearing and sample preparation with AFA. We will take a few minutes to review the AFA technology details. Covaris Adaptive Focused Technology uses high-frequency ultrasonic acoustic energy of shorter wavelengths, ideal for processing biomolecules. The focused ultrasonicated transducer delivers geometrically focused acoustic energy to the sample so that it is not dispersed in the water bath. This non-contact delivery of controlled AFA energy to the sample is critical. The sample vessel is designed and optimized to effectively transfer the acoustic energy. The acoustic waves passing through the solution cause localized pressure fluctuations. The fluctuations cause the dissolved gases to form microscopic bubbles. The bubbles grow, oscillate, and collapse. Graphs show the variations in the bubble radius. The bubble grows, and when it gets bigger, at a certain point, it collapses. These processes generate shear forces. Covaris AFA technology enables precise control of these generated shear forces, and what you are looking at is cumulative effect of hundreds of thousands of cavitation bubbles. It is very important to note that Covaris AFA maintains thermal control during sample treatment. With Covaris AFA, there is no temperature differential between water bath and the sample tube. With the bath sonicator, the heat map shows considerable heat generation during the process, with sample temperature exceeding greater than 40 degrees centigrade by end of treatment. With the probe sonicator, you are essentially sticking a hot metal rod in a small volume of sample, and temperature easily exceeds 40 degrees centigrade. This excessive heat generation results in more damage to the nucleic acid. Now we will introduce you to the TruXTRAC FFPE kits, and the schematic shows that it comes in various flavors. But for today's talk, we would like to focus on TruXTRAC FFPE Total Nucleic Acid Kit that allows for sequential extraction of DNA and RNA. The kit incorporates the AFA technology in its workflow and allows for NGS quality DNA RNA from FFPE tissue samples. The schematic here shows three main steps of FFPE sample processing. First, procurement of tissues. Covaris FFPE kits work with FFPE blocks, scrolls, and slides. Second step is to remove the paraffin. In this workflow, we will use AFA for active paraffin removal and active tissue rehydration instead of organic solvents. And finally, the RNA and the DNA will be purified from the sample. Please note that Covaris FFPE protocol is validated with all instruments, from single sample to high throughput all the way through 96 wells. It is a highly scalable procedure to meet your laboratory needs. Now, in this video, you will notice how quickly AFA de-paraffinizes and rehydrates FFPE samples. The FFPE samples are loaded onto glass microtubes and then subjected to AFA on Covaris instrument. In less than 5 minutes, paraffin is emulsified into inert micron-sized particles that remain in aqueous solution. The tissue is simultaneously rehydrated. The key advantage of using AFA is its highly effective, fast, hands-free paraffin removal. The combination is more effective than chemical and solvent-based methods such as xylene. Given how fast and simple AFA process is, it helps to reduce variability in sample processing with a simplified and standardized workflow. Now let's take a look at data that demonstrates the effectiveness of AFA-based active paraffin removal. To compare the efficiency of AFA-based active paraffin removal to a passive removal with a chemical agent, 3 adjacent tissue sections were cut from the same tissue block. First section was left unprocessed. The second section went through competitor organic solvent-based passive de-paraffinization, and the third section went through Covaris AFA active de-paraffinization method. The amount of paraffin present in the tissue is directly proportional to intensity of blue signal because paraffin has intrinsic autofluorescence property. So when we see more blue, that means more paraffin is left behind. This data confirms 3x lower autofluorescence intensity in Covaris AFA-treated samples compared to the competitor. In summary, by having an efficient paraffin removal, we enable superior tissue rehydration, effective PK dilatation, and this allows for extraction of higher quality nucleic acids. Hudson Alpha Institute of Biotechnology has joined the nation's top cancer research centers in the Oncology Research Information Exchange Network, ORION project. This is a collaboration to accelerate clinical development and discovery of treatments for advanced stage cancers. Hudson Alpha is providing genomic sequencing services for ORION Avatar Research Program. This project is led by Dr. Sean Levy, Director of Genomic Services Laboratory at Hudson Alpha. Dr. Levy has adopted and incorporated Covaris AFA FFPE workflow and TRUXTRAC FFPE Total Nucleic Acid Kit for this project. TRUXTRAC FFPE Total Nucleic Acid Kit is uniquely positioned to extract best quality nucleic acid from your FFPE samples that will deliver optimal sequencing results. The kit uses a dual RNA-DNA isolation workflow where you start with one sample and at the end get RNA and DNA from the same sample. The protocol starts with AFA-enhanced paraffin emulsification that does a gentle lysis of the tissue, gets rid of the paraffin from the tissue, and that takes about 5 minutes. And then you centrifuge down the sample to pellet the DNA, and RNA stays in the supernatant. The RNA supernatant goes through one workflow and you purify the RNA. The DNA pellet goes through one more AFA treatment for acoustic pellet resuspension and enters DNA workflow to purify the DNA. The impact of adopting Covaris workflow at Hudson Alpha has been pretty substantial. Here I share Dr. Levy's data on DV200 metric. The DV200 metric essentially means percentage of RNA that are at 200 nucleotides or longer in any sample. This metric is used as a benchmark QC for a number of RNA sequencing kits, especially for Illumina kits. The left-hand side of the slide is tissues that went through traditional RNA isolation method using organic solvents. Around 20% of these samples coming out of the traditional protocol has a passing metric of DV200 of greater than 20%. Now, the right-hand side of the slide shows similar paired tissues that went through Covaris method, and we observed a full 89 out of 90 samples have a DV200 score of greater than 20%. So this is now very enabling to have majority of these samples passing a key QC metric and entering downstream RNA sequencing. The higher DV200 meant longer RNA, and it translated into better sequencing results. Dr. Levy observed even a more significant impact with FFPE cores compared to the section. And here I quote Dr. Levy from AVRS. When I first saw these results, I said, there is absolutely no way this is real. As you can see, the left side of the slide are FFPE cores that went through traditional method, and only 6 out of 79 samples had passing DV200 of greater than 20%. The right side of the slide shows almost paired FFPE cores being processed with Covaris method, and a full 90 out of 90, 100% of these samples pass DV200 metric of greater than 20%. The majority of the samples pass DV200 metric, and with longer RNA, you can now effectively detect recurrent gene fusions. Higher quality of extracted RNA translates to sequencing more samples with better RNA-seq data for faster turnaround times. In addition to qualitative assessment of RNA quality with DV200, it is critical to assess the quantity of amplifiable RNA extracted. Thermo Fisher Scientific developed the functional RNA quantitation RT-qPCR-based assay, which quantifies the concentration of amplifiable RNA and correlates it with the percentage of valid mapped reads. Covaris TruXTRAC Total Nucleic Acid Plus Kit compared to the competitor Q's extraction kit for kidney, liver, and uterus tissues. The samples falling below the red dashed line, FRSQ score of 0.2 nanograms per microliter, are considered to be poor quality and likely to produce poor sequencing results. Covaris extracted samples displayed more than double the quality acceptance criteria of 0.2 nanogram per microliter, both with high confidence and quality sequencing results. This data demonstrates the DNA yield from the kit, and most importantly, the amplifiable DNA yield is higher when compared to the competitor method. The DNA was highly amplifiable and further confirms the quality of DNA that comes from this kit. Here are some of our customers' testimonials, and our customers speak for our technology. A few empowering comments are shared here, and a repeating theme from our collaborators is that the largest improvement is in the proportion of samples that pass quality control metrics that enables the samples to enter downstream applications, so no sample is left behind. At Covaris, we are on a mission to reduce variability in sample prep, simplify and accelerate workflow by reducing sample touchpoints. Here we share a KOL success story that married our Covaris core AFA technology with an automated liquid handler to create a unique end-to-end custom workflow solution that fits the lab's needs from sample prep to sequencing. I coach Dr. Glenn at Omniseq, who believes that going from this box of FFPE blocks through NGS and the actual clinical report has a lot to do with using Covaris instrument and Covaris dual extraction methodology. Dr. Glenn's lab strongly feels that success of his clinical lab depends on automation to drive scalability and reduce the human error. The ultimate goal of his clinical lab is to reduce sample touch points. And in this workflow, the only time the clinical sample is intervened by an operator is at the first step of when the FFPE samples are scraped from the slides and put into the Covaris juice. This is the automation system workflow that is currently being used at Omniseq, and we have partnered with Dynamic Devices to integrate Covaris LE220 Plus with the Lynx liquid handler. Omniseq is using this end-to-end custom solution to process 24 samples per run, and this has been critical for their success and high throughput needs, and allows for clinical samples to go from extraction all the way to being put on the chip for sequencing. The final message I would like to leave you with is, even with advanced analytical technologies, low-quality biomolecules will result in low-quality data. Clinical customers need automatable, scalable, robust, simplified, and cost-effective solutions. Covaris FFPE workflow offers high-quality RNA and DNA and can be easily integrated into high-throughput automated platforms in clinical labs. You are going to end up getting higher DV200 scores, improved QNS rates, and that will ensure all your clinical critical samples enter the downstream processing workflows, including sequencing. I would also like to acknowledge the key innovators and contributors who brought AFA technology and FFPE product portfolio to the market. Here is our contact information. Please contact us for your FFPE sample preparation needs and collaborating on your workflow. Thank you.